he has now finished 4 treatments, and with each one, he has seen increasing improvements to the point where now he is communicative, speaking in sentences to his family, telling them how much he loves them, not destroying anything in their house, greeting them when they come and go, sitting at a restaurant or they went to a furniture store for an hour and then saying, "That's okay, Mom," when things were taking longer. These are things that were unheard of for the decade that I knew him prior to TruDOSE. Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. It's Dr. Nancy O'Hara, and welcome back to Demystifying PANS PANDAS. I am so excited to welcome 2 people that I have grown to know and love over less than the past year, and they are the leaders of TruDOSE, Tapley, Holland, and Elena, Herning. Welcome.
Thank you.
Hello.
So I want to tell everybody that it takes a lot to get me to believe in a new intervention. I need to see the science. I need to see the proof. I need to believe in the project to be able to recommend it to my patients. And as you both know, I came to TruDOSE kicking and screaming. I did not want to do it. I did not want to recommend it. I did not understand it. But I was willing to try it myself based on the fact that several other physicians who I highly respect, who I have mentored, and who I work with really believed in TruDOSE and saw its benefits. And that's how I came to you guys about 9 months ago. So I wanted to have you on the podcast because I think this is an intervention that more people need to understand. So why don't we get started? Tapley, why don't you tell us what is...
So TruDOSE is a therapy involving your body's platelets, right? We're all familiar, at least if you're not familiar with the term platelet-rich plasma, what you're talking about is taking a volume of blood from your body. In this case, you're talking about taking a specific amount of blood, and you're just extracting just the platelets, and you're basically discarding essentially your red blood cells. And what we've found is if you can take your platelets at the right dose, the right amount, and we can infuse that back into your body, so using your own body's platelets back into you, at the right dose, it's stimulating a healing response at a dose-specific parameter based on the condition or the symptom of why you walked in the door. So it's very safe, again, your own blood, and it's very easy to do. But platelet-rich plasma is something that's been around for decades. The safety profile on it is well established. What we've done with TruDOSE is said, hey, there's got to be a reason as to why these therapies are inconsistently therapeutically effective. And that all comes down to a dosing issue. So we take the testing parameters of when someone walks in the door. We test your platelets when you walk in the door, and we determine a specific amount of blood that you need to be drawn, and that's placed in the centrifuge to extract the platelets. And then we retest it to make sure, before you give the treatment, to make sure we got the right dose. And what we found is that if you have the right dose for why you walked in, it tends to work for many different things.
And I do know that. It does work for many different things. I heard about PRP into joints, and I'm sure a lot of people had, putting platelets, into joints when you have inflammation or arthritis. Why should this work when you put it just back into your blood?
Well, let's take the joints, for example, because people can really, visually grasp that. If you don't take enough platelets and you put it back into your joint, which we've done, there's thousands of articles on that, that application. If you don't have enough platelets, there won't be any therapeutic benefit. If you have too many platelets, then there could be therapeutically beneficial effects of it, but the structural integrity of the joint itself might be compromised because there could be hyperscarring, and
Got
the
it.
tissue might not integrate like normally. But if you have the right dose, then you have the right amount of integrity, the right amount of therapeutic benefit to where the tissue remodels like it should have done. So if you have an overdosing, then you have something that therapeutically works, but you're risking of it re-rupturing for injury later down the line. If you don't have enough platelets, then there's no therapeutic benefit. If you have the right amount, then it works and it's sound. What we've taken and taken it to the next level is said, hey, what happens when we do this intravenously? Because we know site specifically it can work on that application in the joint as like a burst effect, releasing
Right.
everything into one area. But systemically, it has this ability to master modulate all these different cells that are in the danger response, to kill different types of bacteria, to not kill different types of bacteria, say in your gut microbiome. So essentially, it's essentially master modulating your immune system and your repair system at the same time.
Wow. And it is important that you're also doing it based on the person's problem, whether it be arthritis or PANS, or cerebral palsy. Is that correct?
That is correct because the body is going to display symptoms of what it's telling you what's wrong at that time. So somebody may have a diagnosis of chronic fatigue, but two people with chronic fatigue have different symptoms. One may have brain fog at that certain moment. Another person may have skin issues. So you need to let the body tell you essentially at a high level what's wrong with me right now and come address that problem. And so the skin issue dose is much different than the brain fog dose. And it's not that any dose is going to be harmful to one person, but if you give too high of a dose to somebody, then it could lead to that excessive healing response that just makes healing uncomfortable.
Okay. So, like more pain if you don't have the right dose, for example.
Right.
Okay. All right. So basically, based on the child or the person's weight, size, blood counts, platelet counts, disease or symptom profile, and anything else?
And really, there's got to be an interaction with the provider.
Okay.
Because a lot of times we've become conditioned to say, well, what's the diagnosis? And the body doesn't really recognize diagnosis. It
Right.
recognizes the fact that I'm showing you problems that are underlying, and I'm giving you symptoms to say, hey, this is what's wrong with me. But we've kind of, bucketing those symptoms is how we kind of communicate externally in the real world. But the body doesn't know that. So filling out the different symptom sheets and then getting the intake from the provider kind of comes up with a game plan as to, okay, well, what are we going to tackle today?
Got it.
And what's going to drive the treatment decision? Because 6 weeks from now, your symptoms should be different.
Got it. Got it. And so this is an IV, and if we're not BSing and talking and all of that, it really should be less than an hour, right?
Right.
Correct. And my understanding is that usually the benefit can be seen immediately or after 2 weeks, but usually wears off at 6 to 8 weeks unless you repeat it 3 to 4 times. Is that correct?
Right. Because you have to understand, not you, but just, what's going on during that time point. Right. So during that 6 weeks, there's a lot of cellular kind of reestablishment happening. There's things being fixed. There's, think of your inside of your cells like a computer system where, it has to delete files to upload, new improvements. And that time point it takes for it to delete files to upload new improvements is about a 3 to 6 week window. And then it carries you into that 6 to 8 week period where things start to kind of peter off.
Yep.
So what that means is as new repairs, new immune functions are basically uploaded and modulated, those repairs are fixed forever, unless you do something that's unexpected, and you're not following the provider's kind of treatment guidance. Then it can't.
Got it. Okay. So I came in March of 2025, kicking and screaming, and thought, well, I have arthritis, and that was what I was coming for. And I just walked in thinking I would feel absolutely nothing. And as Tapley knows, he didn't follow my directions, and so I gave him a hard time about it, but that's okay. But my reaction, my detox, or my Herx reaction or my die-off reaction was intense. And so you talked a little bit about working with the practitioner. It is important to prepare the body, correct? To have a protocol for the days or maybe even weeks before and after the administration. Is that correct? Yes.
Yeah, you have to,
Okay.
because everybody, one person who's got, let's say, Lyme disease, another person has Lyme disease with mold. You can't really attack those two people the same way
Right.
or have some sort of, cookie cutter approach to where I'm going to say this is what all Lyme people get, because one person may need to be addressing mold before and after the treatment differently.
Right, right. So then the second time I did, and by the way, my arthritis went away. And I thought, well, that great. Okay, well, maybe it's just, whatever. And then you offered to do another one. I said, no, I'm good. And then at 8 weeks, I was in Australia and my arthritis came back with a vengeance. But I thought, I'm traveling, I'm not sleeping well, I'm, working too hard. Anyway, you then very graciously gave me another treatment in June of last year, and my arthritis went away again. I didn't accept your next invitation because I thought I'm good. I couldn't accept the invitation after that because I was working too hard. My arthritis again came back again. And yet the third time I am now again arthritis free, and we'll see how long this one sticks because that's what I do. I can't follow your protocol. You have to prove it to me every time. But anyway, one of the things, I worry with any new intervention that we're not doing enough research. That, you have the N of one of me. And by the way, dozens of my patients that I have now referred for this treatment. As you know, I don't do it in my own office. So this is not about me making money off of this treatment. This is about me recommending something that I have found really works in a large majority of my kids. And by the way, my own husband, who is now your biggest fan. But what are you doing to help prove that this really does work? Research, protocols, etc.
If you've tried everything, medications, treatments, lifestyle changes, but still struggle with chronic symptoms, it's time for something different. Thousands of patients have already discovered the power of TruDOSE, a revolutionary therapy that uses your own blood platelets to target inflammation at its source and jumpstart your body's natural healing. No guesswork, no unnecessary treatments, just science-backed, personalized care that works. Ready to take control of your health? Find a TruDOSE provider near you at TruDOSE.com.
We're now heavily into doing, the more objective research. And you have to understand, anybody's listening, that when this was launched, let's say 2018, for me to say, okay, we could have done this type of evidence then, which is totally true. But really, this acceptance of integrative style medicine, it wasn't what it is today. And everybody's now seeking this. So we had to, we made the decision to kind of let the patient, testimonial really drive the foundation of what this is, because everybody's going to trust somebody else who has the same condition, or at least to a degree you are, because you're actively seeking those treatments and those therapies. So you flash forward to today, and what are we doing? Well, now we're going to give the evidence, in an objective way. For example, we're doing an oncology study. Why? Because we've seen too many patients with, I'm not going to go into this subject, who are having too good of benefits with oncology problems. And we need to say, okay, we've got something here. We need to do it in a very rigorous format. With the PANS and PANDAS kids and autism, we know this works, but, we're going to take it a step further and say, okay, how is this affecting the microbiome? Because I can tell you anecdotally, we're doing a study with Dr. Sabine Hazen, and you know her. And we just did a pilot study on 15 kids, and we saw, I believe it's 8 or 9 of the kids, their bifidobacteria increased. I know off the top of my head, it had a significant impact on Prevotella, and it had a significant impact on C. diff. And the one thing,
E. coli.
and E. coli.
Yeah.
So those are a lot of opportunistic bad bacteria. And the one thing that I saw was that, hey, isn't a good response, can that also mean that it affected all the bad bacteria and it didn't touch the good bacteria? Right. And Sabine's like, well, you know what? Now that you're saying that, yeah, that is because all the therapies we have right now, like antibiotics, they don't discriminate. They kind of, they hurt the good and the bad bacteria. But what if you had a therapy that just attacked the good and said, hey, sorry, the bad, and said, hey, you're the good bacteria. I need you. Let me leave you alone. So that's kind of interesting. We're also doing a study with sexual dysfunction where I think we're close to 170 or 80 patients into that one. The results on that are nothing short of really good. We are doing a study on autism,
sports medicine,
and sports medicine,
as well as a lot of different areas in women's health.
Wow.
Lichen sclerosis, the chronic UTIs, endometriosis, the whole 9 yards. And then
Wow.
we're going to get into the TBIs.
So I think we actively have 5 IRB studies going right now. And, why? Or what made us kind of choose one or the other? And it's kind of like we have kind of a mission to solve kind of things that are really impactful, things that are related to the moms, females, kids, because you look across the specialties, I think we just feel those are just underserved. And yeah, could we choose a number of other things? Absolutely. But we have a mission right now to kind of solve those things.
Wow. Well, go ahead, Elena.
And not even just looking at the good, looking at okay, why did this not work for this particular child?
That's a good point.
Right.
Let's figure out why. Was it a diet situation? Was it, something that they had taken that they shouldn't have? And how do we increase the good, decrease the bad, but taking that percentage of patients who, why is it not working?
Right.
Because across the board, it works so well for so many things, even with mold patients. So,
yeah, I think that's a good point because, the one thing that's good and bad about this therapy is that it works really, really well. But how does it work well with the other modalities that are needed in the integrative space? So what you're talking about is developing ideal therapy protocols,
Right.
and to really understand what is the ideal way we could treat, let's say, a mold patient or a Lyme patient. You kind of have to look at, like you just said, what is working, but also what's not working and what's not working at different time points.
Right.
So that way, these therapies that are inherently good, like ozone and hyperbaric and different types of things, we could hopefully one day we'll be able to say, hey, listen, we've done studies in the research to say this is the ideal way you put these several things together with TruDOSE to have the best option of effectively, a therapeutic journey.
Right. And I think that's a really important point because you said, like in this small pilot study with Sabine, with Dr. Hazen, that 8 or 9 out of 13 improved. And that's great, but it is really important for all of us, and as practitioners especially, why didn't this kid get better? What was different? If I brought you 13 kids that I have been treating for X number of years and 9 of them got better, that's fabulous. But what about those 4 that didn't? And that never seems to get looked at. So I think that is wonderful that's being looked at also.
That's more of I don't want to use the word fun around it, but the driving factor of, we know it's helping all these kids. We know that it raises bifidobacteria, so that goes into Lyme and all of these other things, PANS and PANDAS. But what about the 4? And how can we tweak different things? And can we give them these various things beforehand where this really will come in and work and shift the patient? If we even want to talk about the one patient with the stem cells,
I think it just, I think it,
PANDAS.
Yeah, I think it just goes to that there's a lot of these therapies that are inherently good, right? And the one thing that TruDOSE, I think, does do is I think it will hopefully reveal is what therapies do you build around it and when do you use that particular therapy? Because the one thing that I don't like hearing from parents that are struggling is there's a sea of information out there, that it's hard to weed through it when you're trying to heal your child that has PANS and PANDAS or autism. And you're like, okay, which of these therapies do I start with? And why did that therapy work for him? And will it work for me? I mean, I was there. I mean, you were there with Lyme disease. And I think the one thing that, what's interesting is that, we can measure this in the blood. And I think that's good. But I think I like the fact that we're doing it in the microbiome, because there's so much that we don't know that's information that can be revealed to us.
Yeah.
Based on the individual, based on the species of their individual kind of biome. That's, okay, ozone worked perfectly for this kid. So any kid that potentially looks like that kid, this is an ideal way, microbiome to do, ozone, or maybe hyperbaric, versus the blood, which can dynamically change, whereas your microbiome, it's kind of like that's your signature.
Okay. Okay. And so how do you really see this working? Let's take a kid with PANS PANDAS. What is it working on? Is it working on the particular symptoms that they have? Or is the general that it's anybody with inflammation, basal ganglia encephalitis, autoimmune encephalitis, arthritis from tick-borne disease, whatever? What is it working on? How is it working in them from your perspective?
Well, you have the immune system, and then you have all the inflammatory markers, and then you can use, let's say, some sort of drug to target one specific marker, like inflammation marker, right? And that's great. But how does that one therapy you influence that marker downstream affect other things in the body that it has to basically accommodate for? Whereas what the platelets are doing is they're packed with all the different ways to say, I'm going to raise this, lower this, fix this, raise that. And it can do it real time, very much like a universal adaptogen that's constantly and continuously modulating different things as someone's going towards during a healing, 6-week period. So that's why you see different things happening, and it's not just impacting one thing, but it's impacting many, many different things.
Right. Okay. And
Including,
so
yes, inflammation, whether it's caused by bacterial, whether it's caused by viral, whether it's caused by just over excessive immune system, there's all different types of reasons. But it's, if you just say, okay, if I can just remove dysfunction that's being caused by many different ways, and if I could put one thing in there that kind of just level sets a lot of things that would cause me to have to use 5 or 6 or 7 different things to get to the same point, this is kind of what the TruDOSE therapy is doing.
Okay. Okay. So again, we know that platelets are an acute phase reactant. They're elevated when there's inflammation in the body. And in giving them in a concentrated and correct dose, we see that in many different ways, it's decreasing inflammation and therefore symptoms in multiple different types of diseases, people, etc.
Yes. And
Right?
they always start
100%.
and they always go brain, heart, lungs. So they always target the way our body reacts and responds. So Herring's law of cure, which goes back to the 1900s.
Yeah. What's interesting is that, our body, what we've seen is that our body tends to, in a hierarchical fashion, will heal itself in a very kind of, what's most important. So as we have, let's say, a condition like autism, there's many different things that are dysfunctional in the body, but at all cost, the body will try to preserve and protect the brain, the heart, and lungs, as its 3 operating organs. Whereas, as we face it towards, basically, we push ourselves towards survival. So when you get this treatment, it'll have an impact on those 3 organs first, because those are priority. And then basically the downstream organs it affects that are dysfunctional will be dependent on you, the individual. So it might affect someone's insulin numbers, and because they're diabetic, as the 4th organ of importance or 4th priority, whereas somebody else who doesn't have that, it may, regulate their thyroid and all their different thyroid markers.
Okay. It's sort of like why our mothers always told us not to go swimming after we ate,
Right.
It's the same sort of thing, or why people in malnourished environments, camps, concentration camps, why they don't have their menses or why the kids don't grow when they're sick. Those are luxuries. So
Right.
we're going first in that hierarchical fashion to our brain, our heart, and our lungs, and then other places. Got it. Okay.
You're bringing up a good point. I mean, that's why we're doing a lot of the studies, in women. We're having one in infertility. It's kind of like you're bringing up the thing of, why are so many women, let's say in their mid to early 30s, having trouble with infertility problems? Maybe it's not because of, that's just their predisposition to have these kind of issues. Maybe it's because their body is in such a fight or flight response that it's saying, hey, listen, there's other problems that you're not ready. I'm not ready to help you have a baby yet. But if you can
Right.
get these problems out of the way, you're totally ready.
Right. Exactly. As I said, thanks to Sid Baker and God, I had a son, but maybe if I had TruDOSE, I would have had him 5 years sooner. But anyway, and I have a lot of questions that either patients or other practitioners have asked of me to ask you. So if a child has previously done, for example, IVIG or plasmapheresis, and they have not gotten any improvement or full improvement, are they still candidates for TruDOSE?
100%.
Okay.
I would say this would be the treatment you do. I would, because
in lieu of, honestly.
Oh, absolutely. If they haven't done it, I mean, I have a hierarchy with my
Yeah.
patients, and I always try oral anti-inflammatories and gentler ways to decrease their inflammation first, because this is IV, and nobody wants to stick an IV in their kid.
Right.
But if I'm thinking that a child needs to go on to IVIG or plasmapheresis for PANDAS, then this is something I certainly would consider first because it is safer. It may be as or more effective. It's easier. And if insurance doesn't cover the other two, it is a heck of a lot less expensive.
Yeah, and I totally, 100%. I totally, whenever I'm asked this question by, like, say, a mother, it's hard to, because I know the IVIG has been the one thing that's been kind of like the crutch, that it's hard to go off of that and to kind of put your faith into something else because like the fear of the unknown or whatever that saying is. But the short answer is yes, this totally takes the place. And then it actually enhances further because IVIG would be very much a defensive type of strategy. If this was a game, this would be more of an offensive. And I would rather be fixing the immune system and going on the offense than kind of dampening the immune system and saying, let's just keep you under control. Because that's just going to keep the immune system. I mean, you're not fixing anything. You're just kind of like dampening the problem.
Okay.
And one of our pediatricians who's gotten all of her kids off of IVIG because all of her PANS and PANDAS kids were getting sicker and sicker on the IVIG. So she's gotten them all off and she's recovering them, the likes of which the stories that come out of Dr. Dickerson's are unbelievable.
And I have to share one with our listeners and viewers that I know personally. And he is a young man in his 20s now with autism and developed PANS from mold, as well as tick-borne disease, as well as viruses, including COVID. And although he was doing well for much of his life, after all of those, he devolved into a young man who was nonverbal and also non-communicative. He was a speller, but he had shut down completely. He was incredibly anxious and incredibly aggressive, destroying literally their whole home, ripping up every electronic, ripping up their home, not able to leave the house and go anywhere because of his very intense agitation and anxiety. And we literally had tried everything that we could. And we had thoroughly treated the mold, had left no stone unturned there, had found it in the washing machine gasket, in the dishwasher filter, and all of that. There were little improvements, but never as much as I wanted. And I sent him to Dr. Dickerson for TruDOSE. And he has now finished 4 treatments. And with each one, he has seen increasing improvements to the point where now he is communicative, speaking in sentences to his family, telling them how much he loves them, not destroying anything in their house, greeting them when they come and go, sitting at a restaurant or they went to a furniture store for an hour and then saying, "That's okay, Mom," when things were taking longer. These are things that were unheard of for the decade that I knew him prior to TruDOSE. And that's not an isolated story. That is one I'm sure you guys hear over and over again.
It never gets old.
It never gets old. But it's family dynamic changing, right?
Yes.
So when you're able to get to the root cause with these kiddos who have been suffering and they don't know why they're suffering, and then for the family dynamics to shift, moms go back to work, kids go to school, they're able to socially engage in life again, have friends, have jobs. I mean, the list goes on and on and on. And we get those stories all, every day something comes in.
And I never want to give false hope on this podcast, in my practice or in any. There are certainly children and adults who do not have this kind of dramatic improvement. So there is nothing that is 100%, including TruDOSE. Sorry, Tapley, I just got to say it, But that's why.
We're working to find that percentage of why.
Right.
Because it's important to us as well.
Exactly. And that's why the research is so important, to get at why, like we were saying earlier in that 13 kids, why 4 or 5 did not improve their microbiomes and why it is that these other kids don't improve. So one of the questions one of my parents asked was, are there optimal supporting modalities pre and post, or do you leave that to the individual practitioner? So from your perspective.
I'm glad you asked. You got to leave that to the individual practitioner, because they're really, this is not a cliche, but everybody is different when you're talking about these types of conditions. And you can't attack, there may be some similarities and overlaps, but maybe somebody's doing a particular preparatory modality at the 1 week prior to treatment, whereas somebody else chose to do it at 4 weeks. And those are kind of provider discretion based on what the child or the adult is going through.
But in adding to that, TruDOSE isn't something that you need to prep for 3-6 months prior. You can really use this as a tool to it lights up the dashboard and then work it reverse. Where detoxing beforehand, yes, especially with the kiddos, you don't want to send somebody in a flare out the gate with not knowing anything, from a history standpoint. But you definitely don't need to wait until the body is so cleaned up, because this does clean out various things and works really well with other modalities.
Right.
I would say that the best way the way I commonly explain this to parents or even some providers, the way you need to, look at TruDOSE, especially post-treatment, is what are the symptoms it's showing you? Because it's not going to do bad. It doesn't do bad. It does good to the body, but that good may come in form of kind of bad symptoms. Maybe it's an upset stomach. Maybe it's triggered the strep. Maybe it activated some sort of viral replication or something. But those are all indicators. Okay, well, why do you now have this viral outbreak? Why do all of a sudden is the lymph nodes becoming swollen? It's not just to panic. It's like that's the body telling you, address me, right?
Right. It's sort of like the bad good or the good bad. I never know which way to say that, but sometimes when you get a reaction like a viral outbreak or a detox reaction, it's showing you that that's something that still needs to be worked on more.
Right.
Both through TruDOSE as well as other modalities that you have within your practice to help that person. Right?
Yeah. Let me give you an example. We just saw this earlier today. This was somebody text messaging us back and forth. Let's see. There it is. What's your advice on, this is from a provider. What's your advice on people having antibiotics, having a TruDOSE appointment scheduled? This is the boy we treated in California. he has strep, and they put him on antibiotics on the 12th, which was 10 days afterwards. And then all of a sudden she catches herself and she says, well, I just talked to the parents and they said he was doing really well until the strep kicked in, and he was treated for it right before he had TruDOSE. I just spoke to the mother again. She said this time with the strep infection, he didn't have all the behavioral issues that he normally did in the past.
Right.
They only knew about the strep because his throat actually hurt and his ears hurt. And it's like, okay, we'll address the strep now.
Right.
Right.
And it is part of what we want to see in our PANDAS kids in getting better. You know, what we see when they're not well is that their sibling has strep and they just blow up with tics or anxiety or OCD or some type of flare of their symptoms. What we want them to have is an appropriate response to the strep infection, get a sore throat, get a slight fever, get, other symptoms, and get that treated appropriately without the neuropsychiatric flares that show us an
Great.
inappropriate immune response.
Right.
So yeah, you're showing then an appropriate response.
And I think that's how the text came in, was like, oh my gosh, he was doing so great. And then all of a sudden he got strep. What do you do? It's like, and then as she was working it out, texting it to us, it's like,
Right.
okay, well, the strep came back, but there was no behavioral issues attached to it.
Right.
It's like, well,
You're not going to cure somebody of getting strep from their neighbor or that's not what this is about. What you're trying to do is decrease the inflammation. And in our kids with PANDAS, particularly the inflammation in the brain that causes the anxiety, the OCD, the ARFID, the tics. They're still going to get exposed to viruses and strep. You want them to be healthier, certainly, but it's really the neuropsych symptoms in PANDAS we're trying to
and I think that's
help.
Go ahead.
No, and that's what we find is more treatments with this, the response and the reaction to being exposed to other viruses lessens.
Right.
So, in adults, even in myself, having COVID didn't reactivate EBV. So after all these years, that finally is calmed down. So especially with the kiddos, the neuro inflammation stops, so they can have a normal, if you will, strep response and reaction that can be treated, and you just continue to go down.
And I think that's the one thing that I would encourage any parent that's listening to this, if you're considering this as a treatment, is you use your gut intuition to kind of think through some of this, and don't really discount your gut intuition. In that example that I was just articulating, it was the mom, through that kind of back and forth, was able to work it out and say, okay, well, you know what? The strep's back, but the behavioral issues aren't there. That's a great sign. And B, you're not dealing with the same problem anymore. You're dealing with something that you've now, you're now tackling this stuff one by one, and you're on your way, hopefully, towards some improvement.
Right. Now, you had told me previously, Tapley, that you did have some outcome data from both autism and PANDAS. Is there any of that you would like to share with our listeners or viewers?
Yeah, give me 1 second and I'll pull it up.
Okay. So I think while you're pulling that up, one of the other things is that when we look at this modality, it is one of many that I consider, at least. I mean, we still, we don't want to look at this as only go do TruDOSE and it will cure us all of our autism or PANDAS. What we're all saying is that we still need a whole child, whole body, in my opinion, root cause approach that treats the triggers, the symptoms, and the inflammation/immune system. And this is part of that full picture. Okay.
And this can sort of be the catalyst that gets the patient to the other side. You've gotten them to this place, and then it's just, this is that extra little push that they need to completely shift out of some of these behavior symptoms.
Right. So you have that data? Yeah,
go
ahead.
Hold up. So this was in a case series with 2 pediatric doctors. One of them's a MAPS doctor, and these were 27 kids, all with autism, and we measured these kids with the ATEC score, the Autism Treatment Evaluation Checklist, before and after treatment. And so there were the before average ATEC score with all of these kids, and these were not just kids, but it ranged up into adults as high as 22. So the average ATEC score overall was 84.
Okay.
After treatment, after, it's different treatment numbers, but after about 3 treatments, the average score dropped about 45%. So from 84 to a 43. Now, if you look into the individual domains of the ATEC score, you have sociability. Overall, that improved by 51.6%. The sensory and the cognitive awareness domain, that improved 50.3%. The health physical behavior, that improved 46.4, and the speech language improved 29.5. So if you look at the speech, language, and communication domain, why is it so low? It's because what we saw after about treatment number 3, it goes from about 29.5% as far as improvement to over 50%. So
So it's a little bit delayed from some of the other improvements, which we see with every modality that we use. We often say that speech and language will come later after, other pieces have improved.
Okay.
So,
And with this, it's really important too to know that, when the kids are having these treatments, their ability to learn increases, their language shift, their penmanship is amazing, but you have to practice all of it. So
Yeah.
you have to immerse them differently into education, whether it's reading, flashcards, games, memory games, and all of those things. And then once you start doing that, the way they shift and their little minds they're like sponges all over again.
Yeah.
So the ability to learn starts shifting as those vascular pathways shift, and they've shift from parasympathetic back to the parasympathetic.
I'm gonna take the data a step further and kind of go granular and say, what if we looked into the individual symptoms that the ATEC survey is measuring individually on the, however many questions it is, and said, what are the different things that I can expect as a parent? What can I expect after a single treatment? What would significantly get better? Okay.
Yeah.
And these are the things across the board that we saw was significant improvement. Bedwetting, not wearing diapers, diarrhea, sleep, hyperactivity, self-harm, energy, sound sensitivity, affection, seizures, shouting, stimming, ignoring, eye contact, self-isolation, cooperativeness, and unhappiness.
Yeah.
So those are all things after a single treatment that you could probably say those will probably have a significant improvement.
Right. And then similarly in PANS PANDAS, as this is a Demystifying PANS PANDAS podcast, you get that data up. Yep. And I'll give you my data because we now have about 48 patients, all of whom are PANS PANDAS that I have sent for TruDOSE. And we have about 60 to 65% of those that have improved. And we have what's called a PANS PANDAS questionnaire that was developed and is a standardized questionnaire developed by Sue Sweeto, Tanya Murphy, on a scale of 0 to 4, with 4 being the worst in all of the symptoms that include bedwetting, that include tics, OCD, brain fog, sleep disturbances, aggression, a whole list. And it's, as I said, a standardized PANS PANDAS questionnaire. And we have seen marked improvements in that 60 to 65%. Most of the kids were at 3 to 4s. And of that 65%, most of those parameters are down to 0, 1, or at most 2s. So it's nothing that I'm ready to publish yet, but it certainly is a wonderful trend that we're seeing within our population. And again, I'm not doing it in my office. I am referring these children out. So this is not something I'm doing to just bring in the cash flow. So just wanted to be clear about that.
And that 30 whatever percent, that's the percent I want my hands on.
Exactly.
And I want to see the data on to see, okay, what can we shift? How can we shift it?
Right.
Because the study we did with Sabine, I just need to point out that all of that data was just 4 days later. 4
Wow.
days
Oh, that's true.
after. So we're going to be extending this study and really, really watching it on a long-term effect versus this really short. But we know
Right.
that by day 4, all these things have already shifted in the gut,
Amazing.
especially with the PANS and PANDAS kiddos. Taking that percent that it's not working for as well out the gate and shifting it and seeing what we can tweak and
Yeah,
add to it.
these were only stool
Mhm.
samples. That's a good point. These were only stool samples, 4 days after treatment. So you talk
Right.
C. diff, E. coli, Prevotella, a significant improvement in the BIF, increasing the good, decreasing the bad. And there's so much within that data as far as species that we had to hire somebody who has significant, you can't weed through the data. It's so granular. But, what would it look like for any child who out to 30 days, out to
Right.
90 days, et cetera? And then how does that affect, let's say, their diet and nutrition? How will that need to become modified? So hopefully, well, I think where you're going with this, what we'll be able to learn, or at least be able to say one day is like, hey, this is what ideal looks like. And
Right.
this is, and you're starting here at this spot. And this is what it could look like if you make these changes, absent a TruDOSE, and then you insert TruDOSE at this time point. And then this is hopefully how we can help your son or daughter.
Yeah. Amazing. All right. So everybody's anxious to hear, how do they find out more about TruDOSE? Where should they go?
TruDOSE.com, TruDOSE.com. There we
Okay.
have a provider list. We have a lot. We've revamped the website. It's got a lot of different types of information that's really kind of patient facing. And, I think we're up to close to 100 providers now across America, with a lot more coming on. And, one thing, since this is a PANDAS, a podcast, we're making sure we're doing it, at least on our end, to make sure that all the providers who want to treat kids in the future will have a very level set understanding of how TruDOSE works with across the board. With, if there's a way that all providers could use TruDOSE and do it the same way and do it the best practices, we're moving towards that.
Yeah. That's amazing.
And I think the other thing that we are really focusing on now is having our doctors become mouse trained, because the education the you all do is miraculous. And having the just a general base knowledge. We've got some of our doctors, we had 23 that showed up last spring, and some are, they've been in practice for 30 years and plus, and they were so blown away with what they learned, how it was delivered, the ability they had to access the speakers, the family that MAPS is. So when we're really, really pushing, and we're going to be pushing more so moving forward. So, those looking for TruDOSE also know that their provider can handle some of these things,
That's
because
the main.
And for our listeners and viewers that don't know, MAPS is the Medical Academy of Pediatrics and Special Needs, a premier conference and fellowship for practitioners of all sorts that want to get at root cause medicine, functional medicine for children and adults,
yes.
not just with autism, but all chronic illness. So that's medmaps.org, medmaps.org. And again, TruDOSE is TruDOSE.com. I had to think for a minute. I see it along the ticker tape of my brain. And any last words from either of you or both of you that you want to leave the families or the practitioners that may be listening with?
I I was a patient, so I really have found TruDOSE to be, my body recognized hope for the first time. And so whenever you have something that gives you that little bit of hope, you take it and you run with it. And this really is been a mind, body, spirit healing. It's not just healing Lyme or autism or whatever it is. And we have created and developed this sort of family type, with all of our doctors in treating all these kids. And it's just, it's the why. It's the why we get up in the morning.
Yeah.
Yeah.
Absolutely.
We
Well-
got to fix these kiddos.
Well, thank you both for pushing me to do this 9 months ago.
Your favorites.
And thank you both for being on. I appreciate learning more, and I appreciate the passion. As you know, I share that in helping our children and our families to get better. So thank you both.
You're welcome. It was good seeing you.
And we'll see you next time on Demystifying PANS. Thanks. That's it for today's episode of Demystifying PANS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANDAS.